Welcome to the Navigating Dental Insurance Podcast, where we don't take from insurance companies. Here are your hosts, Mr. Jordan Comstock and Mr. Ben Tuine.
Welcome to the Navigating Dental Insurance Podcast. This is the Say No to PPO's podcast series. My name is Ben Tuine. I am one of your hosts. I have my co-host here, Jordan Comstock. What's up, Jordan?
Yo, dog. How's it going? Sorry.
Speaking of the dogs, poor Georgia Bulldogs last night. You know, but however, you have this kid named Tua Tagovailoa. That's how you pronounce his name. Did you watch that game?
Me? No.
Okay, hopefully my wife isn't listening. My wife is from Georgia. You know, heartbreaking moments for her. But at the same time, this Samoan kid from Hawaii, they put him in the second quarter. I think this is the first game he's ever played in college football. Put him in second quarter. You know, Alabama's sitting on a goose egg. Second quarter, this guy throws 26 points in a quarter and a half, you know, and ends up winning the game. And, you know, it's just a Cinderella story of, but you know, the Polynesian pipeline has now been open to the SEC, which is what many of us have been waiting for. Most Polynesian players end up in the WAC or the Mountain West, or the Pacific 10 or Pac-12. But now it's opened up for them to go to the Southeastern Conference, which to me, you know, the more conferences these kids get to play, the better exposure they get in terms of potential career paths as playing football. But anyway, you mentioned dog, and that's what came to mind.
And that just came to mind.
Yeah,
right on, dude.
Well, folks, thanks for being on chiming into the podcast today. We have an excellent and wonderful guest, a good friend of ours, Dr. Amy Cook out of the state of Washington. So Dr. Amy Cook, she is a general dentist out of Auburn, Washington, where she's practiced since 2006. She does serve as a delegate for the American Dental Association, the Washington Dental Association, and the Seattle King County Dental Society. In addition, Dr. Cook lobbies in Olympia regarding important dental legislation, which we'll talk about today. And she actually drafted one of the original pieces of legislation that passed unanimously through the Washington State House and Senate in 2005. So very excited to talk about that. She also served as an executive counsel for the Seattle King County Dental Society, and currently serves on the King County Multi-Care Foundational Board and the Blue Ribbon Committee for Health in Auburn. Dr. Cook actively promotes access to care for our poor and vulnerable populations by treating patients through donated dental services for the disabled, Domestic Abuse Women's Network, Medicaid patients, Alzheimer's patients, and veterans. She currently is working with Washington State Dental Association and the DEA and the let me read this out, NWHIDTA. I don't know what that means, but sounds like an awesome organization to raise the awareness among dentists and dental patients regarding the issues of PMP, safe prescribing practices, and reducing diversion in our communities. Folks, without further ado, this is Dr. Cook, a wonderful advocate for you as a dentist as well as our patients. Welcome to the show.
Hello. I'm fantastic. How are you, Ben?
Very well, very well. So just some history on how you and I connected. I get an email from you around, I think it was October 2017, and I already knew who you were because I've been following all this legislation that's going on in Washington, and I saw your name around on chat forums up in Washington, on Facebook, and then some other Yahoo chats, and I knew that you were heavily involved in legislation in the state of Washington, but you're also a dentist, and you got started. From what I know, is you've been in dentistry for a while, not just as a dentist, but it seemed like you've worn every hat in the dental office at some point in time.
Yeah, I actually started as a dental assistant. I was a dental assistant for 10 years before dental school and doing my prereqs and did some billing. And so I was pretty familiar with dental billing when I went into school.
Sorry.
And insurance issues.
Sorry, let me. That's great that you're involved in insurance. So this was back in the early 90s that you did insurance billing, Dr. Cook?
It was. I started as a dental assistant in 1991, and mostly I was back office, but I worked in a couple of offices where I did both, and so I was somewhat familiar with billing and PPO fee schedules and updating fee schedules.
Wow. How was it? How much different was it then than it is now in terms of billing? Did you see the number of claim denials back then? Or was it the same, or has it changed over time?
Claim denials definitely seem to be much higher when I started practicing in 2006 than they were when I was a dental assistant. But also the main difference was, of course, that at least with Delta Dental, you could go through and increase your fees every year. You know, whether you were trying to do a 1% across the board, 2-3% across the board, or whether you were systematically trying to just increase a few common fees here and there. And as you all know, or at least in Washington State, what Delta Dental would do is they would give you 100 attempts to try each code in the fee schedule. So you can imagine how much time front office staff was spending trying to figure out, with all these shot in the dark, you know, fee changes, where to set the fees.
Isn't that ridiculous?
Yeah.
It's ridiculous.
Let's give you 100 times to guess on what we're going to offer you.
For each code. So how much money were the dentists paying their staff to do that?
It's interesting because there are some deltas across the country. I can't remember Delta, Wisconsin, or some other states that still allow you to do that. In fact, Delta, Washington, when you go on and file your fees, you can still do that to a certain extent. But what we find is that it's just such a cumbersome process, because if you try to submit a fee that's higher than what they would allow, you have to go back and edit it. And so it takes, the last time I went through and did this for a client, it took me at least about 3 hours, because I had to go through, I think they have 150 codes listed on their database, and I had to go through and edit and delete, resubmit. And it's just time consuming, all to get no increase for that office.
Correct.
You know?
Yeah.
You go through that entire activity, spending 3 hours just to learn that they're not going to provide an increase. But if you don't set the fees at the right level, they could lower them, which is what we've seen last year, is that some offices would file their fees and they were below what Delta was willing to pay, and Delta just accepted them as they were. So I mean, it's kind of like college football in the NFL. You know, when you put the burden on the coaches to challenge a bad call, that's not their job. Their job is to coach the team. It's the officials that are supposed to be making the calls and doing it right. They shouldn't have that responsibility of officiating the game. You know what I mean? But here we are with this whole big mess with Delta, not just in Washington, but across the country. Oh, welcome, Jordan.
Yeah.
Jordan's with us, folks.
I'm here.
So, Jordan,
I'm late, but I'm here.
You're here. Dr. Cook, we met back in October over an email. Dr. Cook listens to our podcast from time to time. And I already knew who she was. Like, she is heavily involved in legislation in the state of Washington for dentistry. And we're going to talk about some of that today. Yeah, she emailed me, I guess, which is something that we'll get into here in just a sec, Dr. Cook. But she emailed me these interesting appeals that she had with Delta Dental of Washington, back then when they were called Washington Dental Services. And to me, in looking at the timeline of things, you know, for anybody that has as much passion as Dr. Cook and energy in terms of just not letting the bullies get away with things, she took that energy and channeled a lot of that energy into areas that were very helpful for dentistry, which we'll talk about here for a second.
Oh, so cool.
So, Dr. Cook, you purchased your practice up in Washington 2007, is that right?
2008.
2008? Okay.
2008.
And then,
yes.
And then back then, you so tell us the story behind your fees, like your view of the fees as you kind of analyze things, and kind of what you thought in terms of your perception on how to deal with the Delta fees back then.
When I purchased my practice in 2008, I was purchasing from a dentist who had been established in the city for a long time, and I didn't realize that she had not kept up with her fee increases, or at least I didn't realize it to the extent. I did due diligence and evaluated the practice, but because I had experience in billing and increasing fees year to year, whatever fees that seemed low, I thought, over time, I will do fee increases and kind of get things caught up gradually, but I don't want to come in as the new, younger dentist and just say, hello, everyone, you don't know me, but I'm increasing your fees. So I decided that this was 50% really stupid and 50% really smart. I haven't quite figured that out, but what happened is that I purchased a practice in 2008 that was using a fee schedule for Delta Dental and many other PPOs that she had not tried to increase for years, and then I was not able to. Delta would not allow me to adjust the fees at all. And then, as you know, in Washington State in 2011, Delta Dental across the board decreased all of the PPO reimbursements by 15%, which violated our contracts, by the way. If anyone out there knows
ridiculous.
how they got away with that, I don't know. Nowhere in my contract does it say they have the ability to decrease the fees. There is a notice that you can increase the fees, but anyway, so I was very frustrated with this, of course, and so I'm operating with these fees that are 2007 fees that were behind for 2007. Then they were decreased 15%. So then on top of that, I was getting these denials for crowns of buildups. And I am a very, conservative dentist. I'm not out there just trying to bang out all the crowns I can do by any means.
I've seen offices that do that.
And I know there are people who do that, but what I have seen, and I've been a dental assistant for a long time, I've worked with other dentists, we see each other's work. I do not think that the majority of dentists are out there just trying to do as many crowns as they possibly can do. I think that is the exception. So I was frustrated, and so I started writing appeals. And by the way, I have overturned every denial except for two. One of them where they downgraded I did a bridge on one quadrant on the lower left. Later, the next year, the guy wanted the bridge on the other side done, and the insurance company wouldn't pay for it. Well, I got out of the insurance company because they had downgraded it to an RPD, or removable partial denture, which he doesn't have. So they would not pay for the bridge on the other side, which is a whole different thing. But I've been very successful in appealing, and I sent you a couple of those appeal letters. But, I go to the insurance commissioner, and I tell my patients to complain to the insurance commissioner. There was an interesting case out of Oklahoma that I love where the patient was denied covered benefits for 2 crowns, and the insurance company made the decision that she didn't need those crowns. And the patient themselves said, okay, I want to see the credentials of this dentist or whoever it is at the insurance company who has never seen me. Mm-hmm. They looked at one x-ray and decided that I did not need 2 crowns, and I love that approach.
Oh, yeah. Yeah. That is the most powerful thing to do, in my opinion, is getting the patients involved in that level, providing them the proper education. Traditionally, we were always taught in when you're in the clinical setting to never bash the patient's insurance. And I still don't know what the fine line is, but I think it's very important for patients to know that you are on their side and that insurance isn't, and if you find a way to do that, you can get these patients involved in these appeals. And that's something that Tessa Nabarni and I have done a lot here in the state of Utah and many offices across the country, and getting them to use the insurance commissioner to advocate on behalf of the patient. Because in every state, that's their job. Their job as an insurance commissioner is to make sure that the patients who pay for their benefits, the insurance, making sure that insurance plays fair and allows those patients to get access to whatever benefits that they're entitled to. So I want to go through this letter, Dr. Cook and Jordan. So this is a letter that after you sent an appeal to Delta, well, back then Washington Dental Services or Delta Dental, I'm going to read this letter. So this is the letter that Delta sent back. Of course, these things are, some of the key items are redacted. So this letter is in response to an appeal filed with Washington Dental Services by so-and-so regarding services under his secondary provider by you, Dr. Cook, on blank date 2011. The appeal request date blank 2012 for crown porcelain / ceramic substrate or 2740 crown on tooth number 31 has been reviewed by the Washington Dental Services Appeals Committee. It was determined that the service provided did not meet the clinical criteria guidelines established by Washington Dental Services to benefit the service under the patient's dental plan. And I'm going to skip to this next sentence that's underlined. Washington Dental Services recommends that you review these guidelines periodically to understand the requirements for benefit determination. So basically what they're saying is that you have to perform dentistry according to their clinical, to their guidelines and policies rather than what's in the best interest of the patient. So the letter continues and says,
wow.
The Washington Dental Service understands that patients rely on their dentists to know the requirements for their dental plan. So in other words, it's more important to understand the requirements for the dental plan than what you actually need clinically. So the letter further states the Washington Education Association wants its members to be informed, consumers, about their health benefits. Again, health benefits, not about their health care. To be an informed consumer of their dental benefits, Washington Dental Services is encouraging patients to ask their dentist to explain the reasons for the service being recommended. Are you flipping kidding me? As if
we don't do that.
If informed consent doesn't require you to do that already. I mean, isn't that everybody's obligation is to explain people's health condition? So the last,
at least I'd hope so. Yeah.
the last paragraph. This is the last paragraph. Further appeals of this nature for services that do not meet clinical criteria guidelines, of course, this is by Washington Dental Services, to benefit the services will result in Washington Dental Services placing you on a focused review for services by authority, including your provider contract. That is so flippin' ridiculous. You know, when I read letters like this, a lot of doctors across the country, when they send me letters like this, where an insurance company is threatening to audit their practice, I wonder how many of them
to audit the just.
Well, this is a threat. I mean, I wonder how most doctors feel. Like when you first got this letter, Dr. Cook, how did you respond initially? What were your initial thoughts?
You know, I mean, I can't even remember, but I thought you're going to put me on focused review. I thought they were going to audit me. I wasn't sure what that really meant, but that really fueled my fire at that point. Yeah. And after receiving that letter, I had attended a continuing ed lecture in the Seattle area that was very well attended. It was huge. This was after the 15% fee reduction in Washington State. So dentists everywhere were just buzzing about this. And I was at this continuing ed lecture, and everyone was talking about this at the coffee breaks, and I happened to sit next to a dentist, and she said, you know, there's some dentists in Bellevue who are having a meeting, and it's a meeting for dentists to meet with our legislators.
Oh, cool.
And at this time, I had a lot of frustration, and I was collecting evidence, basically, not knowing what I was going to do, but just having frustration and advocating for my patients. And so I went to this meeting, and I took a little packet of information, and I met with some key dentists who were already meeting legislators. They knew a lot. They knew how to go down to our capital city, Olympia, and testify in front of the healthcare committee. They knew legislators who were on the healthcare committee. So I went down, and I was so impressed. These legislators came, and they listened to dentists, and I met some, and they listened to me. And it was really, there were a couple of independent dentists in Washington State who were already making inroads, and they have taught me a lot about this. I'm the newcomer here. But I took my ideas and my frustrations, and there was one legislator in particular, Kathy Dahlquist, in the Auburn area where I practice, and she listened, and she said, well, let's write a bill. So, okay, so we did, and we got together, and we wrote this bill, and the bill, it's a fair dental insurance bill, it's House Bill 1002. I provided you with the link to that.
Yeah.
What eventually, it passed unanimously through the House and the Senate in Washington State.
Wow.
And you know, I learned a little bit about lobbying, but really it was because of one main dentist, Dr. Cynthia Pauley here in Washington State. If you haven't met her and talked to her, she's the president of the Washington State Dental Association. She's described as being a force of nature, and she's absolutely brilliant. So she knew some legislators and took it and really lobbied it. But what it says is that, first of all, if a patient comes in for an emergency exam and you assess their needs and you have time to give them the treatment, whether it's a crown or a filling or whatever it is that day, the insurance company cannot deny covering the treatment the same day that you diagnose and treatment plan. So dentists out there will know, they'll be familiar with this. You'll have a patient come in for the emergency, and then you be faced with this choice. Okay, do I do the treatment today, and then they don't pay for the exam and evaluation and x-ray and pulp testing, or do I have to tell the patient to come back another day so that they have insurance coverage to actually do the treatment? So they cannot deny emergency treatment the same day we do the emergency exam in Washington State anymore. And then the other part of the bill is establishing reporting for minimum loss ratios. So during this process of working on this legislation, the ADA News shows up on my desk one day, and the front page cover says, oh, the state of California, the Dental Association, is working for minimum loss ratios. And what that is it's looking at the premium dollars that are spent in the month and setting a percentage. Like the insurance company can only take, say, 15% of that to pay themselves. They have to spend 85% or something like that on the patient care. And that came out of the Affordable Care Act. Mm-hmm. So the Affordable Care Act actually established that medical insurance has to pay 85% of the premium money to the patient. And so California was trying to get a percentage. We decided to go for reporting, and we got that in this bill. So now all of the dental insurance companies in Washington State that are standalones have to report how much of that money they're paying themselves to the insurance commissioner. And by the way, I have to say our insurance commissioner, Mike Kreidler in Washington State, is fantastic. He has been very responsive to me as a small independent dentist and to dentistry in general. So very thankful for that.
That's awesome.
So cool.
Yeah, I saw some reporting on that from the CDA, and then earlier last year when you had that meeting to sign a petition. When was that? In September?
With the Delta?
Yeah, with that Delta issue. And then there was some reporting in a couple of articles that I read about this issue. And it's interesting to me, I don't know what Delta is reporting in terms of how much of the premium dollars are going towards patient care. But in one of the reports that I saw, they claimed that at one point in time, over 94% of their money went towards patient care. And
yes, that was in the letter.
I ran into a Delta Dental executive, a periodontist, retired periodontist, who was a former higher up for Delta of California. You know what he said? He said that reporting is total bogus. It's total BS. And he said, here's why. He said, number one, I know, I've seen the numbers, and Delta's found a way to get around a lot of the, they found a way to fudge the numbers to report back to the community a false image of exactly where the money is spent. But only 33% of insured patients that have a Delta plan or Blue Cross or MetLife, only 33% of those patients use their benefits. Only 6% max out their benefits every year, and then only 22% of those patients ever have come in and use a deductible. So there's severe underutilization of dental plans across the country, and that provides for a huge opportunity for insurance executives and owners of insurance companies to make money on the backs of the dentists who are laboring and providing the care and not getting paid a reasonable rate.
Yeah.
Like insurance companies can afford to pay dentists more, but what they do on the reporting side is completely skew the numbers that only they could understand in a way to report falsehoods about where the money actually goes. The reality is, according to this periodontist, a lot of the money goes towards a reserve and profits for the insurance carrier, which is not factored into their reporting. And so it was interesting that one article that I read that said 93 or 94% of premium dollars went towards patient care. And I sent that to this periodontist, and he laughed. He says, I can provide evidence that is not true. So in other words, insurance companies are really being unethical when it comes to reporting and finding ways to undercut the dentist. In the end, if it's a publicly traded insurance carrier, their responsibility is to the shareholder, not to the patient or to the dentist. And then an insurance company like Delta Dental in most states, I think, is your Delta still a not-for-profit?
Yes. Which is laughable. But yeah, it is.
The question I have is, what's their motivation? I mean, why is their motivation to lie, cheat, and steal the patients and the dentist? I just don't understand. I think part of the understanding is looking at the pay increase for their CEO. Since 2011,
right.
the
Totally.
Delta Dental of Washington CEO doubled his income since the pay cuts in 2011. If there's any motivation as to why they do the things they do, that's it, in my opinion. So I deal with brokers on a day-to-day basis that sell dental insurance, and we are on a mission to get brokers to stop selling Delta Dental. We've been successful in Minnesota, Wisconsin. Utah, Delta doesn't have the biggest presence here. We have our problems with local insurance carriers. So Utah, we've met with brokers here, and they we paired them with other dental plans that provide competitive commissions for them. And, Delta Dental, the thing about Delta is, number one, brokers need to stop selling their plans. Number two, there needs to be a way for dentists to stop participating with Delta Dental at some point. I know now that's a difficult thing to do, especially in Washington. But my opinion is when you're participating with an insurance plan, you are indirectly endorsing all of the crap that they give you and the patients. And the best way for any individual dentist to protest an insurance carrier is for that individual doctor to find a way to cancel their agreement with that insurance company. Easier said than done, though. So our mission in 2018 is to help doctors find ways to exit their Delta contracts in a way that won't harm their bottom line and won't cause them to lose patients to the extent where they can't survive. But I think... Well, go ahead, Dr. Cook.
I would love to hear on the podcast from some dentists who have dropped Delta, because I know it's extremely difficult to do and stay afloat, but people have done it, and I think that getting that conversation going and hearing what it was like and trying to band together and help each other is a great idea. I know a year or two ago I was at our state dental convention, and I was in a little lecture that was just packed, standing room only, and it was a lecture given by an out-of-state accountant, very young couple of accountants. And they were talking about how to survive in the age of PPOs, and all of us have these deep write-offs. And one of the things that they said was sign up for as many PPOs as you can, and if your neighbor dentist down the street drops a net life or something, you swoop in and get those patients.
Oh, no.
And I said, now, wait a minute. I was in the back. I said, where are you from? And they looked at me. I said, are you from Washington? No, we're from California. I said, are you familiar with the 15%? They said, no. I said, okay, so here's what's going on in Washington. We've all just our contracts have been violated with this 15%. And you come in here and tell us that if we're brave enough to drop a PPO and we figure that out and we do it, our neighbors should come in and just sign up and take those patients. That's not what we do. We should be supporting each other.
Yeah,
totally.
We should, we have to be careful about price fixing and colluding and everything, but we need to be supportive and we need to be communicating with each other.
Exactly. I agree with you 100%. In fact, I've been invited to speak at the Washington State Dental Association this June, and I'm not going to spill the beans on what I'm going to get into, but it is going to be around how to survive when you drop a plan. And everybody should support each other, because that's what we started here in Utah. I attended all the CQI meetings here for our association last year, and that was our message, is that the ADA published some research that was done about the correlation between PPO participation and reduced fees. So here in Utah, over the last 10 years, our average PPO reimbursements have gone down 10%. And that's because most of the doctors here participate with a bunch of plans. Well, up in Montana, where it's the lowest, the state where the least amount of doctors participate with dental insurance, their rates have gone up 16% over the last 10 years. So that chart and study, it shows evidence, or at least a correlation between PPO participation and reduced fees in a state. It's not about making doctors rich or finding ways to nickel and dime patients. It truly is about finding a way to protect the financial integrity of the care. Dentistry costs money. It's not cheap.
Yeah.
Doctors are worth every single penny. And when insurance companies start to force doctors to take less.
Discount.
Naturally, what you see, and this is not true for every dentist, but like what Jordan sees on the lab side, we see doctors cutting corners. And we interview them and ask them, and we get down to the true reasons, and that's because they're feeling penny pinched. They just, to seat a crown for $490, you just can't do that. You can't do that with a great Emax unit. You have to. Some of them feel like they have to use the cheapest materials in order for them to survive, and it's just largely a lack of support and education on what to do in those situations. But I'm totally with you, Dr. Cook. Would never, ever stand up in a room and say, y'all need to join PPOs. In fact, it's the opposite.
Ridiculous.
Y'all need to find ways to drop PPOs.
I was going to say, what's our website title again, Ben?
Say no to PPOs.
Yeah, totally.
Well, and another part of that is a lot of my patients are older. They've been with the practice for a long time. I have great loyal patients, but a lot of them are retiring from Boeing and getting off their Delta PPOs. And they ask me, what do I do? And I used to steer them toward the AARP Delta plan, and I don't anymore. There's a dentist here in Washington State, Dr. Greg Yen. You probably know him. Jordan, you're probably familiar with him. He talks about the wellness plans, and I hired Dr. Yen to come in and help me. He was very careful in crafting his wellness plan, very well connected with the Office of the Insurance Commissioner, and my patients love my wellness plan. It is such a fantastic benefit for them. It's a much better consumer product for the consumer than paying, they pay on average $650 a year for an individual plan that gives them $1,000 max with waiting periods.
Yep. Sounds like an awesome deal.
I know. Yeah. When I spend a lot of time appealing, and actually Delta is leaving me alone. I don't have to appeal as much as I used to. But with these appeals, I know I will get less money getting that PPO payment than I would without the insurance. But it's a consumer advocacy issue, and I think we need to learn from our physician colleagues and their mistakes, and we need to educate our patients to fight back and to say it's not okay to deny, it's not okay for the insurance company to tell me what I need, what's medically necessary. You've never seen me. And we have to consider that the dentist has malpractice insurance. So the dentist has a really strong reason not to overtreat, not to do the wrong thing. We don't want to get in trouble. I think there are people out there, I know there are dentists who overtreat, but I really know that it is the exception to the rule.
Yeah.
But the insurance company has no responsibility, no liability. So where are they to say what the patient needs? They have no skin in the game. So it's a real patient advocacy issue, and I think getting patients into wellness programs is a fantastic way to transition. I know all my patients who are retiring out of a PPO plan sponsored by their employer, they go to wellness plans.
And on that, Amy, I'd like to talk to you more because I know your state has some interesting regulations on that that we can talk after the show in detail if on a later date. But that's something that I do want to talk to you about since you have some experience with lobbying and understanding kind of what your state does over there. But that's something that I'd like to work with more because I have lots of people from Washington reaching out to us to create these membership plans, and the state, it just seems like it's not totally in the dentist's favor. You can definitely tell that there's been the other side lobbying against that in your state. But that's something I'd like to schedule a time to talk with you about that.
Yeah,
absolutely.
Yeah, what you described, both of you described here with the wellness plan and membership plans, my prediction for 2008, I'll say it on this podcast. We recorded another episode yesterday, so just in case this is posted first, my prediction in 2018 is that Delta is going to lose market share nationwide, and they're going to lose it because more and more doctors are doing their own wellness plan or membership plan. Employers are starting to realize that Delta Dental is not in their best interest. Delta Dental is not advocating on behalf of their employees. The truth is coming out behind dental insurance in 2018. I don't want to spill the beans on exactly what the public is going to hear, but I got a sneak peek of some of the advocacy efforts that are going to be aired by some special interest groups this year on national TV. And these folks are going to be interviewed by CNN, Fox, and NBC and the major news networks. and you're going to start to hear more and more and more behind the truth of insurance. So my invitation for everybody out there that's a dentist is, I love what Dr. Cook is doing in terms of her involvement with the ADA, the WSDA, the Seattle King County Dental Society. A lot of doctors ask, the question of, organized dentistry, what's in it for me? Well, here's what's in it for you. You get legislation created by your own people, your own kind, your own colleagues. And without your own colleagues like Dr. Cook, really a lot of these advocacy efforts that are helping dentists wouldn't exist. So I'm a huge supporter for state associations, the American Dental Association, when it comes to these efforts. But I want to give you, Dr. Cook, your closing thoughts on your future, any recommendations you have for dentists, both on the newer end of the spectrum, right out of college, to those that are getting ready to retire, and everybody in between. Any closing thoughts for them?
Absolutely. I want to say two main things. Number one thing that I wish I would have done was, before I signed any PPO contracts, I would have utilized the free contract review that the American Dental Association provides for you. That is so valuable. Absolutely free. And do that, please. Once you sign the contract, there's nothing they can do. So that's number one. The other thing is, I really want to make the point that I'm just a small-town general dentist. I have no special training or knowledge in lobbying or legislation or anything. I went onto my Washington State Legislature's website, and I actually listened to how people give testimony on bills. And I learned from other dentists who were doing this, and it's really been a learning process. I'm not an expert by any means, but I'm talking and I'm listening and I'm meeting people, and the average dentist in a small town just like me can make a difference. Legislators absolutely want to hear from dentists, because that's one area where we are still considered the experts in oral health. There are a lot of bloggers who think they know everything about fluoride and everything, but we are still considered the oral care experts by legislators, and they want to hear from us. Please contact your legislators. Become active with your dental association, ask questions, and appeal, and contact your insurance commissioner.
Cool.
That's awesome advice.
It does help.
That is awesome advice. Well, Dr. Cook, and most people out there are probably thinking, do you have a consulting firm, or do you provide counsel on a day-to-day basis? Dentistry is your full-time job. Is that right?
It is, absolutely. Mm-hmm.
So
and being a hockey mom.
There you go.
Nice.
So we really appreciate you coming onto our podcast, because you really have nothing. This is the great thing. You have nothing to gain by being here. Sharing your information is wonderful, and we know your time is so valuable, and we just want to take time here to thank you so much for spending the last 45 minutes with us on the program. And we hope that your words inspire those that are out there that are trying to engage in advocacy efforts on their own, and those that may not be engaged, that feel inspired to get involved some way, somehow. And we just wish you the best as you move forward, and hopefully we'll have you on the show as some of my predictions lay out, and we'll share some of those things with you on a personal level in a way that could possibly benefit your practice, and then perhaps in the future you can report on future things in terms of advocacy efforts that now I'm going to get involved with in the state of Washington, and we can have some fun teaching, educating, and motivating others to do the same. So again, Dr. Cook, thank you so much.
Yeah. Thank you. Thank you so much.